When you look in the mirror and lift up your tongue, does it look like this? This is called a lingual frenum. Everyone has one, but sometimes people's are just way too big. That's called a tongue tie. So again, this is the lingual frenum. It serves a really important function. That's why we all have them. The frenum acts as kind of a tether from your tongue to the floor of your mouth. That helps your tongue from just flopping about anywhere. It also helps with movements, control during speech, and function. Sometimes these are too big. As we said, that's a tongue tie. What does big mean? Big means that this attachment extends too far towards the tip of your tongue. So the tether's important, but we want it to be closer to the base of the tongue, not extending all the way out towards the tip. That's when it causes restrictions and a whole variety of symptoms that aren't great. This patient here has a pretty severe tongue tie. When we asked her to stick out her tongue as far as she possibly could, this is what she was able to do. I know that I personally can stick out my tongue a lot further than that, and I don't have a tongue tie, so let me demonstrate that for you. So, when you can't move your tongue the way that you should, it can cause a lot of different symptoms that we're seeing, like obstructive sleep apnea, snoring, mouth breathing, difficulty kind of cleaning food off of your teeth, or finding that you're pouching food in your lower or your upper jaws, tooth positioning issues, neck pain, poor posture, a whole wide variety of issues just because you can't move your tongue the way that you should. So what are some ways that you can identify at home whether this is a concern for you? I would say if you're suffering with any of those symptoms that I talked about earlier, that would be one of the things to look at. Another would be there are a couple simple exercises that you can do in the mirror that would kind of give you an idea if this is something that you should have evaluated. I would say the best way is for you to look in the mirror and open your mouth as wide as you can. You should then take the tip of your tongue, put it up to the roof of your mouth, and while keeping it there, open your mouth as wide as you can. Those two mouth openings should be very similar. If they're not, if when the tip of your tongue is up on the roof of your mouth, you're not able to open nearly as far, that's a pretty clear sign that you're dealing with a tongue tie. Another one would be testing and kind of sticking your tongue out as far as you can. You should have at least a thumb width that you can stick your tongue all the way out. If it's less, if it's similar to this patient, something to consider. Another would be looking in the mirror when you elevate your tongue, sticking the tip to the roof of your mouth. If you notice that the tip kind of goes heart-shaped, or you notice that there's a significant pull kind of changing the shape, that would be another reason. As always, all of these are just kind of simple ways for you to check at home. The best thing to do is get evaluated by a dental professional.